Hey, this is Dr. Emily Schaheen here. I am a board-certified upper extremity orthopedic surgeon. So we see a lot of baseball in the summer, basketball in the summer, beach volleyball in the summer. And so frequently, and I've seen a big influx in the office recently, frequently people can sustain finger dislocations during any of those kinds of sports. And so that basically looks like if you have a hyperextension injury, a torque injury, or maybe just like a jammed finger injury, the joint can dislocate, relocate. And sometimes it's a spontaneous relocation. So a jammed finger is basically an injury to the surrounding soft tissues that stabilize the joint, so the ligaments. And they can either get partially torn, a sprain, or completely torn. And if they're completely torn, the joint can completely dislocate. In some cases, the joint does not spontaneously relocate. In some cases, patients may relocate the joint themselves. They feel like it's out of whack and they quickly pull on the finger and it pops back into place. In more severe cases, the joint may stay dislocated and they may have to go to an emergency room setting to have it relocated. But by and large, most of these dislocation, relocation injuries are treated without surgery. So that's the good news. So typically, a jammed finger, a dislocation during football or volleyball gets relocated, whether it's by the patient or in the ER. As long as the joint is stable following relocation, we can start early active range of motion of the joint. Typically, we'll buddy tape the fingers together, so taping it to an adjacent finger will provide stability while still allowing for motion. So the big risk with these is that the joint gets stiff. And so that's always in hand surgery. We're trying to avoid stiffness at all costs. So if you get one of these injuries, a dislocation, relocation, gets really swollen, you're concerned about that, then I would go in for an x-ray, get evaluated, either the emergency room, urgent care, come see us in the office the next day, because it could be that this is a fracture that needs surgery, or it could be a ligamentous injury that we need to stabilize, without surgery, and then kind of help you through the recovery period to avoid permanent stiffness. So if you think that's the case, let us know. We're happy to see you in the office, and stay safe out there.